The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video was useful for you, don't forget to like the video and subscribe to the channel for support. OZOBAX solution, which is in the musculoskeletal system drugs class, is presented in 473 ml glass bottles. The active ingredient of the drug is Baclofen. What is OZOBAX solution? What is it used for? OZOBAX is a muscle relaxer that is used to treat muscle pain, spasms, and stiffness in people with multiple sclerosis or spinal cord injury or disease. How to use OZOBAX solution. Take this medication by mouth with or without food as directed by your doctor, usually 3 times a day. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device spoon. Do not use a household spoon because you may not get the correct dose. If your liquid form is a suspension, shake the bottle well before each dose. The dosage is based on your medical condition and response to treatment. Do not increase your dose or take it more often than prescribed. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Do not use extra medicine to make up for a missed dose. If you miss a dose or forget to take your medicine, take it as soon as you can. If it is almost time for your next dose, wait until then to take the medicine and skip the missed dose. Things to know before using OZOBAX are as follows. Before taking Baclofen, tell your doctor or pharmacist if you are allergic to it or if you have any other allergies. This drug may make you dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Avoid alcoholic beverages. Before having surgery, tell your doctor or dentist about all the products you use. Older adults may be more sensitive to the side effects of this drug, especially drowsiness and mental mood changes. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. This drug passes into breast milk. Consult your doctor before breastfeeding. What are the side effects of OZOBAX? The most common side effects of OZOBAX include drowsiness, dizziness, weakness, tiredness, headache, sleep problems, nausea, constipation, and urinating more often usual. If this video was useful for you, like the video and subscribe to the channel for support. Share your views and experiences in the comment section. I wish you healthy days.